All right, we're loading. Howdy, my name is Tori Jackson. I am the coordinator of the LGBTQ+ Pride Center in the Office of the Dean of Student Life at Texas A&M. My pronouns are they, them. I would like to start off by thanking our panel, Dr. Alison Pittman and Matt Hoffman, for taking the time today to come talk with us about LGBTQ health. We are have a couple of talking points, and then we'll open it up for audience questions. You can submit your questions over Facebook Live. And with that, if y'all would like to introduce yourself and just a little bit about why you wanted to come talk about this topic today.
I guess I'll go first. I'm Alison Pittman, and I am a clinical assistant professor at the College of Nursing at Texas A&M Health Science Center. I was very happy to speak today because LGBTQ health is a great interest of mine. My background is pediatric nursing. I was a bedside nurse and a critical care nurse for 13 plus years, and then went into teaching and really experienced a lot of disparities in youth and young adults that were part of the LGBTQ community, and so my interest in helping and improving those and getting rid of those disparities really came out of that. And I'm part of an interdisciplinary team at the Health Science Center, made up of faculty from the College of Medicine, nursing, dentistry, public health, and pharmacy that are trying to improve our educational efforts for our students to help them be more comfortable, be more knowledgeable, and be better communicators when they're providing health care to the LGBTQ community.
Howdy, everyone. I'm Matt Hoffman. I also work in the College of Nursing at the Health Science Center with Dr. Pittman. I use he, him, his pronouns, and I was excited to be able to come and participate in this panel because I am a family nurse practitioner and I own my own private practice in Bryan and have been serving the LGBTQ plus community ever since I started as a nurse practitioner about 5 years ago. So this is something that's near and dear to me. I deal with these questions and a lot of COVID concerns, as well as just general LGBT based questions with regards to health promotion, et cetera. So again, just super glad to be a part of the panel and look forward to answering y'all's questions with Alison.
Oh, there we go. Awesome. So our first topic that Dr. Pittman broached was y'all wanted to talk about guidance for people who are already hesitant to seek healthcare because of past negative experiences.
Sure. I can start, and I'm sorry, I forgot to mention my pronouns are she, her, and hers. Matt and I think really complement each other well because he's a primary care provider mostly and really has a lot more experience with primary care. I'm more meeting people on their worst day, you know, with my experience in critical care, ICU. But I think that we need to acknowledge that our community, the LGBTQ community, really has a history of being discriminated against when they're seeking healthcare. And for that reason, based on past negative experiences, many persons are very hesitant to seek healthcare. And when we are in a very fragile environment health-wise, like we are right now, we need to acknowledge that those past experiences exist, but also acknowledge that we need to be very aware of what's going on around us and the fact that we're all kind of in this together, and that we need to be very knowledgeable within ourselves about what the signs and symptoms are of our current pandemic and know when we need to seek healthcare, even if it has not been a positive experience for us in the past. And that's really a good starting place to sort of acknowledge that even if you have not been treated fairly or have been discriminated against or faced a provider who had a vast lack of knowledge about where you're coming from in your health, in your gender identity, and in your sexuality, that that sometimes we have to go back out there and try again. And especially if you're experiencing the symptoms of COVID-19, we really need to be aware of when we need to seek healthcare and sort of lean on each other during this time. So I'll let Matt talk about his experience in providing that care.
Thanks. Yeah, to add on to what you'd said, we see already in the data that any marginalized population is at increased risk for poorer health outcomes. That is with chronic illnesses as well as this acute COVID situation that we found ourselves in. So again, speaking to any negative experiences that you may have, what we see out there in the literature is really that a lot of LGBTQ plus individuals are going to avoid healthcare if they've had those negative experiences. Some will even avoid them and never had an experience, but just being anticipatory or fearful of that negativity or that bad experience. And so what ends up happening is if someone waits until the very worst possible moment to seek care, especially in a situation like this with COVID-19, the outcomes are going to be worse. So it's compounding what we're already seeing in terms of poor outcomes among marginalized populations, especially within the LGBTQ plus population. The data really points to there already being existing risk factors. Specifically, the LGBT population is known for smoking more. Additionally, any individuals with HIV or any kind of immunocompromised situation, it's just going to compound to added risk. So this is definitely one of the times where you don't want to wait till the last minute and really just do what you can to seek out providers that are going to be open and accepting. And then again, if you can't guarantee that you're going to find someone like that, have a support system with you. The worst part about this situation is in emergency rooms and even just the inpatient hospital units, they're not allowing visitors, but really leaning on support systems is going to be something that hopefully helps give you the impetus to seek care in these times.
Thank you both. And then the second thing that y'all wanted to address was how social distancing, sheltering in place is affecting outreach and visibility programs.
Matt, I don't want to go first every time. Do you want to start, or would you be more comfortable with me?
You put me on the spot, so I'll go ahead and go. So what we're seeing is that there is a really big drastic change in the way that all of us are living our day-to-day lives. And a lot of the places that we go to for outreach and support, they additionally in unexpected ways are changing their methods of providing care or providing resources simply because they have individuals that they're trying to protect as well. So everyone's kind of in this very shy, timid, not sure what's going on, what to do, et cetera. So the best thing right now in terms of if there is a resource that you need, we have phones, we have websites. Make sure that you do your due diligence to call. At this point in time, I have on any given day, if I need a patient that needs to get labs or some sort of radiologic study, I'm telling them to call in advance to make sure that you find out when they're not as busy. You might even be able to schedule appointments. Right now, a lot of what we're seeing is just some erratic patterns in terms of things being available, especially with community resources that are needed. I'm not sure if Alison, you want to add on to that?
Yeah, I completely agree. I mean, I think we're all sort of suffering the mental toll of being separated physically from our friends and our family, and even work. I even miss my work and being there. And I really I really think that we haven't quite realized the toll it's going to take, especially for people who really rely on community programs to get by, and the fact that they're having to reach those in different ways. As a pediatric nurse, I am seeing a lot of families who struggle with food security. And I know we have a lot of college students that also are experiencing that, and trying to get food is a challenge, and it invokes fear. You know, just going to the grocery store makes us anxious. And so I would really encourage our community to really seek out the resources that are available through Texas A&M and through our local community centers. If you are experiencing anxiety or any physical or emotional need, reach out. That's what we are all here for. And we have online support groups, and you know, reaching out via Zoom with members of your community and family and friends is really, really important. I think that if you're doing okay, still reach out, because you could be a resource to someone else. If you have it in you right now to really listen and lend an ear, I think that is needed desperately. And just knowing that someone else out there is experiencing that isolation or any of that anxiety and fear about what's going on about our health and everything else is really, really important. So kind of make an effort to really be a part of those online communities where we can lean on each other, I think is really important.
One thing I would add specifically with regards to resources is the Resource Center. You know, number one, thank you for hosting this. I think that it's just one way of providing a service, especially when we can't do it face to face, when you're not able to have students come in the door, et cetera. There are a lot of resources, and the Resource Center has networked in such a way to be able to make things available that you might not have thought necessary, or at least point you in the right direction. So it's great that it's available to A&M students, but make sure that if you're not an A&M student and you're seeing this, you reach out anyway to make sure that you're at least privy to the resources that are available within our community, because I guarantee you're probably going to be surprised about things that you didn't know that you may have had access to or would be available to you in your time of need.
Thank you both. Thank you for the plug, Matt. So I had a question before we dive into some of our pre-submitted questions about trans healthcare and resources right now. I've been experiencing a little too much news at the moment and seeing a back and forth with things. And so I think I was looking, and I'm sure there are people watching this who are looking for some clarity about things like hormones or affirming surgeries or just other things like that. And you two being medical providers, I was hoping maybe you could provide us with some information about trans or PrEP or other LGBT specific medical resources.
Sure, I'll go ahead and jump into this one. So that's definitely something that I've seen in my personal practice. A lot of my trans patients that have never experienced anxiety before are experiencing anxiety because of this pandemic. One of the things that I do is I receive updates from the FDA with regards to any kind of drug shortages. And right now there are no known drug shortages. So the biggest concern is individuals exhibiting hoarding behaviors with medications, the way that we've seen kind of in grocery stores with certain items, toilet paper. But you know, we're starting to see that individuals are maybe wanting to hoard medications. That's not something that's necessary at this point. However, I do understand the concern. In most cases, a lot of providers are also extending refills. So if patients need to come in and it's their scheduled follow-up, right now they understand if you're not symptomatic, don't come in, don't increase. So it's just even a possibility to just call your provider and say, hey, I need a refill. can I just get that extended at this point in time? So yes, I'm afraid that there may be some future medication shortage if individuals are hoarding. So that is something that information has come out to prescribers to make sure that we're not encouraging and really promoting over prescribing in any way, so that way individuals have a greater quantity. You mentioned gender affirming surgeries, and right now there are a lot of hospitals that have shut down their OR services specifically for elective procedures. So if it's not an urgent acute care type of procedure, it's not happening, it's being pushed back. And as unfortunate as that is, it is for the safety of everyone involved. So there are still remain a lot of possibilities and options, specifically if someone were to I just hate the thought of somebody having been on a wait list or something and looking forward to a procedure and then have it postponed. But in the end, it really is for the safety of the patient as well as the hospital and clinic staff. You don't want to be exposed to something. Additionally, anytime that you're out post-operative, your body has taken a really big physical shock, and that increases your risk of post-operative infections. Additionally, pneumonia is a really big complication after any procedure, and we don't want to add to any added respiratory compromise on top of the COVID-19 situation. I'll turn it over to Allison.
Yeah, those are all, you really covered it really well. The only thing that I would add that I know people are concerned about is, you know, a lot of times gender affirming surgeries are not covered by health insurance. And many of us who, if you're in the service industry, if you're, you know, so many of us have jobs and careers that are not very stable right now. So just acknowledging that as part of the stress and anxiety is important, that the ability to afford your treatment may be a concern for you. But Matt is right that those decisions to postpone surgeries are really for your best interest, for everyone's best interest. You do not want to be in a hospital during a pandemic when you don't need to be. And I just, you know, there's, Tori, you touched on this, that we are in news overload, and so much of it is focused on negativity. And you know, I find that the LGBTQ community, and particularly the transgender community, is so profoundly resilient, and we need to focus on that as a community. Just really knowing that, think about everything that you have gone through in your life so far. We can get through this too. We can get through the delay in perhaps you know, having your surgery, having being able to make the choices in your life that you've wanted to make to become the person that you want to be. You know, for the sake of our health, we can be resilient a little bit longer for the sake of our own health and keep going. And I really have to find myself stopping with the news barrage and really focusing on the positive things and the community and the helpers and the things that we do for each other that lift each other up, because it can get really overwhelming.
I want to add just one thing to that with the news and information overload. This is one of the opportunities for us to also really closely evaluate our information sources. Additionally, evaluate the frequency with which you are getting your information. Personally, I limit myself to 2 times a day, in the morning and in the evening, where I actually look at news and information along those lines, unless there's something that comes up in the middle of the day and somebody brings to my attention. But that helps me maintain my sanity. But as a healthcare consumer and information consumer, which we all are, really looking at your news source, making sure that what you're getting is unbiased, or as unbiased as it could possibly be. But with what we're hearing right now, you know, there's a lot of scary scariness in the world with medications. You know, the hormone fear is out there, but from what I see from the FDA, which is a reputable source in terms of the information that I'm getting, that's something that I at least am able to rest easily knowing that, okay, the FDA says this is not a problem. I'm not going to consider this a problem at this point in time, but continue to monitor. So really look at your information source. If you hear something sketchy, do a little bit further evaluation. I don't have Facebook because I was overwhelmed with all of the information, I'll do that, that people were sharing. And it just really framed social media in a negative light for me. So I backed away from it. So maybe if you notice a form of social media that's really bringing you down with information, try to avoid it. Limit it a little bit, do something along those lines to help maintain and preserve your sanity during these times where we're oftentimes stuck indoors most of the time. Additionally, the only other thing that I would say is try to find some activity that brings you joy. I heard one professor in another college is actually at the beginning of class holding a silver linings moment. So she's asking everybody to share some sort of silver lining with the class of being in quarantine or being in stay in shelter. So just those small little gestures is something that can really spin it and put a different perspective on us being stuck indoors during these moments.
I love that. And I do the same thing. I check news in the morning to make sure nothing drastic happened overnight, and then I ignore it all day because it'll make you crazy. Yeah.
Solid advice. Thank you. So we're going to jump into our pre-submitted questions. These were taken beforehand. If people are interested, they can submit them over Facebook Live, and we will also get them to Matt and Allison. All right. So our first one starting off. As someone in the queer community who is looking to enter a career in healthcare, I want to find work that combines both my queer identity and working in the healthcare field. Do you have any recommendations on how to do that, especially as a senior who is graduating in May?
That just makes me super happy. And I know it does Matt too. I think the world is your oyster. I mean, the medical and health providing community is vastly undereducated in LGBTQ health, and that's really what a lot of my research and interest is in, is how little all health professions know. And so if you want to enter the healthcare field and improve and work with this community, it starts with your education, whatever career you decide to pursue. Really being aware of the type of education when you're choosing where you want to go post graduation and what kind of career you want to choose. I think it's really important to see what kind of content they provide and what kind of curriculum they have that acknowledges and provides some education on specific needs of our population here. And, the reason I say the world is your oyster is because there's so much we don't know and so much that we can do better. There's very limited funding out there for health research, and we're really trying to improve that. But we are slowly, as a health providing community, acknowledging that we can do better. And so I think there's a lot that can be accomplished if you're interested in improving the status quo, if that makes sense. Matt.
Yeah, congratulations on your upcoming graduation. I know that graduation is going to be a totally different experience this year, but it is a great accomplishment nonetheless. The thing that I heard is kind of how, or any recommendations for getting out into the field or maybe choosing a field, since I didn't hear a specific area of healthcare. But the thing that I have counseled undergraduate students is to think about what's going to make your heart happy, what's going to fulfill you, what's going to fill your cup, and then project that out and see in 5 years, 10 years, is that still going to be where you want to be? Can you picture yourself still being content and loving your job? That's one of the things that is experienced in the healthcare field is burnout. And so it's really a lot of knowing what you can handle emotionally, physically as well. Depending on what area, you'll have different expectations and maybe be pushed a little bit more than others. So I think that's something to definitely consider. Especially in nursing, we hear a lot of nursing burnout. I'm personally concerned for our current nursing workforce. I anticipate we're going to experience a lot of people with diagnoses of PTSD after this. It's very traumatic. My friends who are continuing to work in hospitals, and what we do see in the news, some of the situations are just horrible. It's never a fun thing to see someone struggling to have just their body perform basic functions that we take for granted. And so a lot of our workforce is seeing this repeatedly every day of shifts. And the psyche is definitely something that's going to be impacted. And of course, we couldn't anticipate this happening, but that's something, your own mental resilience and your ability to bounce back is something that may be tested in the healthcare field. So I always encourage people, especially in the healthcare field, counseling. It's tremendous. I grew up here in Texas, and I learned over the years that counseling and therapy kind of had it absolutely had a negative connotation. If you said that you were seeking counseling or anything along those lines in terms of sharing your own mental health struggles, that was something that was a bit taboo. And then once I started going into college, I learned through a lot of friends, it became normalized, and certain areas of the country even are more accepting. It's still, unfortunately, something that nationwide we continue to see a bit of almost, I guess taboo is just the best word I can think of right now, a taboo perspective of people sharing their mental health struggles. But just because you're in the medical field doesn't mean that they don't exist. So it's something that everyone should be cognizant of, especially going into a really high stress type of profession, regardless of what field it's in. Alison, is there anything you want to add?
Yes, I mean, I'm so glad you brought that up. And I, like you know, I am not a bedside nurse right now based in a hospital, but I have so many friends and colleagues who are, and some of them can't even talk about what they're experiencing yet. And I, like you, am concerned about when the peak comes back down and we have time to really process what we're seeing as a profession. And don't get me started about the lack of protection we're providing for our healthcare workforce. But yeah, emotional burnout is no joke. And there is a huge stigma about seeking mental health. And we could have another whole session. In fact, there's a webinar coming up soon by the LGBT Education Center, the National Center on mental health during COVID, and how critical it is to pay attention to that. So, you know, I agree wholeheartedly. And, you know, you don't have to be a healthcare profession member to experience that emotional burnout during this time. So, you know, like you said, Matt, I think we all need to have a toolbox of you know, I envision it as your gas tank, your ability to do your daily life and your job and take care of yourself. When that tank is empty, you need to find those things and make a list and put it somewhere of the things that refill your tank, whether it's exercise, walking, loving your pets, you know, cooking a meal, you know, those things that bring you comfort and rest and rejuvenation, we've all got to reach in and get those things out of our tool bag to refill our tank.
Thank you both. So our next question is, how can we be the best allies if we're not a part of the LGBT community? Not just right now, but always. I'm gonna hop in on this one and then I'll let you two answer, if that's okay. So some of the things that the center recommends is educate yourself. Don't expect people of a marginalized population to be the ones educating you. That produces sort of a double burden on them. Listen to what people are saying, really listen, hear about them, hear about their experiences, know resources. If you know resources, that way if someone reaches out to you for help or just being, stressed, like Matt was saying, if you're going to be a part of that support system, sort of know what's available. And then something I took away from a conference once was treat people the way they ask to be treated. We usually think about it as treat people the way you want to be treated, but we're sort of flipping that on its head and treat them the way they ask to be treated. It's not about you or your experiences, it's about what they need. And so acknowledging that and treating them in that way, whether it's with pronouns, names, those sorts of things, it can be tricky, but think about how much it's been of their life that they've had to live that way. So those are the center's recommendations. And now I'm going to turn it over to Dr. Hoffman and Dr. Pittman.
I'll go. We're both so polite. I really applaud whoever asked this question because it's a brave one, and I am an ally. I really, even though I don't identify as LGBT and I am cisgender, I really think that it's very important for nurses and healthcare providers to educate ourselves much better and make things better for this community. And I really think that the first thing you said would be the first thing out of my mouth is just to educate yourself. It can be a little bit intimidating sometimes to people who don't know a lot of people in this community, the alphabet soup of acronyms and things. So really find some really reliable resources and educate yourself on not only on the right way to communicate, but how to speak respectfully, how to respect people's privacy. Not everyone is going to want to tell you their whole gender and sexual life story, and they don't have to. And, especially in healthcare, I think we think that even if someone comes in for a sore throat, that we need to know their whole life story, including their whole gender journey and their sexual orientation, and that's not what people want to do. And so we really need to focus on what that individual person, that patient, that client needs from us. And I think if no matter whether you're in healthcare or you're just a person that wants to be an ally, I think that's an important thing to acknowledge and remember.
I reiterate everything in terms of the education component. The only thing that I would add is it's an exercise in humility and being able to recognize what you know and what you don't know, and being open to receiving added information and knowledge. And I've been on both sides of the coin as a member of the LGBT community. I have had those heteronormative experiences where someone assumes that I am married to a female. And it's one of those things that definitely gets me bristled. And but I'm forgiving in that I just recognize, okay, it's not important. The reason why I'm here in this seat with this individual is not to discuss heteronormativity, even though, yes, it's not okay. Anyway, but that's one of the things I just kind of focus. Why am I here? Is that important to this? Additionally, on the other side, you know, as Allison pointed out, it's something that everybody is coming to the table with a different experience. Individuals may be just ready for that heteronormative or cisnormative experience with a healthcare provider, and that's a barrier that they've placed up going into the experience. So it's not necessarily going to be the most positive outcome if you go into it already feeling on guard. So again, that exercise in humility and being vulnerable, but then also knowing, okay, this is definitely not okay. I'm not going to come back here, but I'm going to continue to seek out whatever care I need. So that's just really the only other thing to reiterate what Tori said. Don't expect someone to be the information source, and also don't expect your one experience with maybe a trans, bisexual, or you know, in this heterosexual cis gender provider, you know, if you have a negative experience with this one person, don't let it frame every other potential experience that you may have.
Awesome. Okay, so one of the questions we have is, many of our students have moved out of Bryan College Station community and may be looking for new healthcare providers. How would you recommend that they determine if a local provider or local providers are supportive of the LGBT community and are knowledgeable about LGBTQ health issues?
Good question. So there is a website, the GLMA. I don't like the name because it's very exclusive in that it's the Gay Lesbian Medical Association. But their website actually has a directory of providers that actually have registered and opted into sharing their availability and sharing their specialty area. I'm available on there. I know one of the psychologists, Iris Carrillo, she is also listed as one of those providers. So they provide a lot of different specialties. Again, the individuals that have opted in are obviously the ones that should be GLBT friendly. And then from there, what I typically do is I give my patients referrals to individuals that I have had personal experiences with, or I know that are safe and should be positive experiences. The other thing would be to ask around, reach out, and talk to others. I can't tell you, I've had patients that found me through the GLMA website. I've had some patients that found me through a Discord server where some people were talking about local providers. So just ask around. The other thing that I want to touch on real quickly to divert, this would be a really good chance, especially we can't assume that our students that are back home are in positive living situations right now, especially if there's a strained relationship with family or having to be closeted or anything along those lines. So again, knowing those local resources within the community that you're currently in is going to be something really important, especially if you're struggling in any other kind of way.
Yeah, the only thing I would add is, you know, don't discount the positive aspects of technology, because even if you are far from the community that you consider home and you have a healthcare provider in that community, my 76-year-old mom FaceTimed with her cardiologist yesterday, and that, you know, who knew that kind of stuff was happening? You know, reach out to a provider that you are comfortable with, if you have one, and see if they can treat you long distance. You know, we have great telemedicine, you know, technology now, and it doesn't take more than a couple of cell phones. You can talk with your provider confidentially about what's going on. They can actually do a very routine sort of physical exam. You know, hopefully they don't have to listen to your heart with a stethoscope, but there's actually technology for that as well. And, you know, be able to send prescriptions to your pharmacist wherever you are, and go from there. So know that it can often be an option. Just call and see.
Yeah, to add on to that, I will definitely say during this COVID-19 experience, telemedicine's been something that every provider has basically had to jump on board with if they wanted to keep their doors open. The way I've explained it to patients is if you don't actively have something protruding out of your body, then there's not really a reason for me to have to see you face to face if we can have telemedicine encounters that can achieve mostly the same thing for non-acute situations. But with that said, one of the things is there may be assumptions made that you have access to internet or enough high-speed internet or resources to be able to have this kind of communication. We can still have phone visits. Phone visits, if it's not an acute must-see type of thing, are currently being covered by most insurance plans. So again, another assumption that you have insurance coverage, but reaching out to your local health department or any of those county community types of resources are going to be one of your best options in terms of scarcity, because right now everything seems to be scarce in one way or another.
Yeah, I would reiterate calling the local county health department wherever you're located, especially if you're low on resources, finances. One thing that Texas does pretty decent job of is having, those resources affordable and available. So just calling ahead. I know a lot of people hate picking up the phone and calling anybody, and I get that. I'm that way too, but this is one instance where it might be worth your while just to see what kind of resources are out there. And I see some comments on Facebook Live of already people are sharing, I know providers in this area and that area. So the importance of word of mouth is it can't be understated. So.
And I just want to add one more thing. I mentioned earlier that the Resource Center has the ability to kind of tap into resources, but the university as a whole does as well. I just recently learned yesterday that there are emergency funds available for students as well as even faculty and staff. So if extenuating circumstances arise, the university itself may be something, it's definitely going to require some phone calls and a little bit of work. But it would be definitely worth the time and effort put into it.
Awesome. Okay. So our next question, a couple of weeks ago, there was information from the health community that taking heart medication, ACE2 could, I think that's how it's pronounced. I'm sorry, I'm not a doctor, could cause complications with COVID-19. Later, the information came out that this was a myth. Is this something we should worry about?
I'll go ahead and jump in because I had patients sending me messages via the portal with this exact same question. And so I reached out to a local cardiologist and said, what are you recommending? Because I've not seen anything from the American Heart Association or any of the medical guidelines that we follow. A lot of resources are being updated right now as data becomes available, but everything is still so fresh. A lot of the ends in studies are really too small for us to be able to apply them more broadly. But what we found was that in this particular situation, the change was so small and it was on a molecular level that it might increase the opportunity for COVID to actually be able to cause an infection in someone. Again, it was not one of those things that was broadly applicable, but her recommendation specifically was to that right now the risks of taking the medication versus benefits, the benefits outweigh the risk in that. Specifically, whenever I had conversations with patients saying, do I need to change to a different medication? Right now, you want your body to be performing at its best. So if this particular medication keeps your blood pressure in check, you don't want to throw a different variable into the mix that might need to be titrated up. Cardiovascular risk is one of the big things that makes somebody, or cardiovascular illnesses are one of the components that actually put somebody at increased risk for COVID. So if it's not broke, don't fix it, especially if the data doesn't really support it. And to date, there's not any updated recommendations or guidelines that says the ACE inhibitors need to be stopped or changed.
I just wanted to clarify what the N was. You said that the N was too small.
Yeah, sorry. The N being the populations that were sampled for the studies. Sorry.
Awesome.
So I think it's just important to emphasize that there's no research out there yet that shows that folks that are on these medications are at increased risk. It's just a theory right now, because when you're dealing with receptors on cells, the theory was that the virus could somehow have easier access to cells and because of those receptors, but there's there's so little we know about this virus and how it behaves. What we do have is hundreds and hundreds and hundreds of studies that your blood pressure medication, your ACE inhibitors, diabetes medication was also in the news about this, keeps you from getting sick. And all of the experts say, do not stop those medications. That in terms of risk versus benefits, the risk that will create for you is far greater than the perceived, not proven risk of being more susceptible to a virus because you possibly might be because of these medications. So you do not want to be experiencing high blood pressure, a heart event, a diabetic coma when our hospitals are full of people who have this virus. So stay on your meds and trust the system. If something comes up that tells us that there's a risk, you can talk to your provider, but for now, we need to kind of stay the course and stay on our meds.
Thank you both. So another question, for an individual who's interested in gender affirming hormone therapy, but who has not talked to a healthcare provider about that, is that possible to do through telehealth?
Yes, actually. So there have been a lot of regulations and legislative changes that have been passed to temporarily allow for new patient evaluations and consults. So as long as the provider that is being seen for the gender affirming hormones provides or offers verbal and informed consent, that would be something that could potentially get started. Oftentimes there are still some procedural things that have to be taken into account, specifically just kind of that initial evaluation along with some blood work. I'm just generalizing at this point, but yes, there are some changes in the time being. Normally, if we weren't in a pandemic situation, you would have to have a face-to-face appointment. But this is one of those things, if you're stable, don't have any current chronic illnesses that need to be addressed, then it's something that you could take advantage of right now.
Neat.
Sorry, I don't have anything to add. He covered that perfectly, and he's much more of an expert on that than I am. So, yeah, I don't have anything to add.
Awesome. Okay. So I think those are all of our comments and questions from Facebook Live so far. I think we did a pretty good job of covering a lot of these things. If y'all are looking, that's all. Yep, that's all the questions. Sorry, we have a helper who messaged. So thank you all so much for stopping by. Thank you for listening. The Resource Center is open. We do virtual office hours. If anyone is looking for resources near and far, we're happy to connect y'all. And thank y'all and have a good night.
Thank you.
Thanks.